either side of the dooms of the diaphragm, you see the lung base is placed, right? And this is the anterior border, and this is the cardiac notch, and you can see the lingula is present. And as you see, the posterior border is not well defined, it is blurred. Inferior border is very clearly shown here. Inferior border is clearly shown, that is the inferior border. And you can also identify that on the costal surface there is an oblique fissure. See the oblique fissure, right? And this is the medial surface, which is divided into vertebral part and mediastinal part. Now, right in the center, you can see the hilum of the lung, where structures enter and leave the lung. And this is the cardiac impression of the left lung. Cardiac impression of the left lung is present here, right? And in the class, I have mentioned so many characteristic features in order to differentiate right and left lung. But in the spotters, all the characters you are not going to identify in a given 1 minute. So use little bit common sense and make sure which are the important identification point you can easily identify. Since it is a left lung, all the left lung, definitely it is going to show the cardiac notch, lingula, right? And all the left lung, you are going to see the arch of aorta impression and descending aorta impression clearly. So once you see this arch of aorta, descending aorta impression and cardiac notch and lingula, you can directly tell it is a left lung, right? And structures in the hilum, you see through the naked eye, you can identify the cartilaginous rings on the bronchus. If you want, you can touch and feel the bronchus also. And last lab, I have told how to identify the pulmonary artery and the vein. Vein lumen will be collapsed, the walls are very thin. The lumen of the artery will be patent and the walls are thick. In the bronchus, definitely you are going to see the cartilage very clearly, cut section of the cartilage, right? Now, if you touch the real lung, this is the plastinated one, and if you press between the two fingers, lungs are porous organ. Since the gaseous exchange has taken place, it is difficult to touch, right? And if I put this in the water, it is going to float because of the gaseous exchange has taken place, and it looks black or mortared in color, gray color, because of the inhalation of the carbon particles. If you take the same thing in the fetal skull before birth or stillborn baby, see the lung, it is pinkish in color. And since the gaseous exchange has not taken place, if I put the stillborn lung into the water, it is going to sink. It doesn't precipitate when we touch between the two fingers, right? So this is how it will be made use in the forensic medicine. If they found a body, a fetal body outside and wanted to find out whether the baby has died before birth or after birth, they can see the color of the lung, they can see whether it can float or sink in the water, right? Whether it precipitates or not, right? So this is one of the methods used to identify whether it is the fetus has born before death or after death, right? So now you can see this. Here the right lung is present. We can see small horizontal fissure and oblique fissure is present. And you can see the trachea bifurcating and entering into the hilum of the lung. As you go deeper, I have told how the trachea is going to branch inside the parenchyma of the lung, right? So you have to know what is the difference between bronchus and bronchioles. If the section of the lung is given to you, main identification point under the microscope we are going to see in the next week to identify bronchus and bronchioles, right? Based on presence or absence of the cartilage, right? Now, here is the left lung. I am going to show this is the costal surface of the left lung. Entire thing is the costal surface of the left lung. And you can clearly see the oblique fissure. That is the oblique fissure dividing into upper lobe and the lower lobe. Upper lobe and the lower lobe. Right? Now, see this anterior border of the left lung. This is very thin. Anterior border is present. Very thin anterior border. Right? And this is the tongue-like projection. What I am holding, that is the lingula. Morphologically represents middle lobe of the right lung. And small cardiac notch is present. Right? and well defined inferior border is present. This is the inferior border, what I am pointing out is the inferior border, and this is the base of the lung which is situated on the left dome of the diaphragm, separated from the left lobe of the liver, fundus and the spleen. Right? Now, this is the costal surface which is well marked by the ribs and impressions of the ribs you can see on the costal surface also. When I turn this left lung on the medial surface, see the very clear impression of the arch of aorta, impression of the descending aorta, right? In the right, in the center of the mediastinal surface, you see the hilum is present. And morning we identified the bronchus is there, pulmonary artery is there, superior pulmonary vein, inferior pulmonary vein, right? Surrounding the hilum, we have studied the pulmonary plexus, hilar lymph nodes will be present. Anterior-inferior, you are going to see this is the cardiac impression. Since it is the left lung produced by the left ventricle, right ventricle and part of the left auricle. Right? So, you can see clearly the arch of aorta, and there is a vertical groove produced by the left common carotid artery, and sometimes you can see the left subclavian artery also. Right? So, this is how you are going to identify the impressions on the lung. In the spotters, it will be pinned like this. Identify the pinned impression.